So before we start to suture, and you can see that we've got a setup here, and this is a fake wound. I haven't got gloves. I'd normally be in a sterile environment with all the other issues that we have. But this is a teaching video. We've kind of simulated everything, so that's where we're going with it. I'm going to have something to support and move the needle, and one of the things that you need are a pair of forceps. These are the forceps that you have here, and there are all sorts of different ones. If I just put the needle down, I might be able to show you. You might see that these have got very fine teeth. These are called toothed forceps, and the way to hold them is to actually hold them between finger and thumb. Many people will hold them in different ways, or they'll hold them like this, or they'll hold them like this. It's not. It's literally like holding a pencil that you're going to use for a brush stroke. Some forceps have got no teeth. If you look at these, you might be able to see the difference between them. They're smooth all the way down. Even though they've got these little rough serrations, they haven't got the teeth at the end. Those teeth are pretty tiny, and we might be using those if we're handling delicate tissues, particularly eyelids or lip, something like that. Some forceps are much more robust, and you can see these here. These are fine. The problem with these is that they can sometimes crush the tissues if you apply too much force. So the idea is that when you're doing something on the wound, you're not crushing the tissues, you're using these simply to turn back and fold back what you need to be able to see. Last thing we need is a pair of scissors to cut the stitch. So we'll just have a look at these now for a second. Most scissors will come in different shapes, different sizes. We call these scissors, they're called tenotomy scissors, purely because the end of the scissor isn't flush with the shaft. You can just see a little shoulder on either side, and you can hold scissors in different ways, but the point is that you want to, when you're starting off suturing, use your other hand, use this hand to support the scissors, so that then you can then angle them anywhere you want. The worst thing you want to do is to feel under pressure and shake when you're coming to cut a stitch, never quite sure what length to cut. So if you use your other fingers, you hold them there, you support them there, you've then got a platform to work against.